Hi, my name is Jenny Dennis. I'm the publisher of Skirt Magazine, and you are watching one of our Women at Work series videos. Today, I am here with Kalen Ashford. She is a certified physician's assistant here at Dermatology and Laser Center of Charleston. Hello.
Hi.
Thank you for having us here.
Thank you.
And this video is going to be about anti-aging, and I feel like this is a really important opportunity to offer some education because we all know that everybody loves to read Skirt Magazine every month, but I think sometimes they see some of these procedures, some of these offerings and these techniques and specials, but they don't really know what it is.
Right.
And they may be nervous or they may have questions and they want to kind of feel at ease before they pick up the phone and call or that kind of thing.
Right, sure.
So why don't you give us a brief overview of the different types of anti-aging and kind of start with that.
Okay. Well, we could really go into so many different things. There's so many things that we could do for anti-aging, but some of the things I'd like to focus on today is fillers, volumizers, and what we call wrinkle relaxers or neuromodulators. So that's your Botox, Dysport, ZMN. There are other brand names of all the fillers and volumizers, but they do different things. So I'll have people come in and they'll say, I want Botox for these lines.
Okay.
You don't put Botox here. This is more of a filler.
Okay.
So so I think some people are confused about what to put where.
Sure. And so a filler, is that sort of like what the name says? It's filling something in?
Right.
And a relaxer, I'm assuming, is relaxing something?
Relaxing muscles.
Okay.
So
And so volumizer would be what? Giving something
exactly
more...
what it sounds
Yes,
like.
okay.
Adding volume, so giving you structure to your face.
And how do you know which one you need? Because like you said, we all look at ourselves in the mirror and we're like, oh, we're start pointing out all these things. How do you know? I mean, I'm sure that's what you're for.
That's
but,
that's what you
talk to us a little bit about the difference in, the technique, maybe even the cost, or is there any kind of pain associated or downtime, like that kind of stuff?
Yeah, absolutely. So kind of a general overview of how you know what you need where. You would need to go to your provider or your injector. So they're going to help you navigate what you're going to need for what areas concern you. So I always start out by asking what areas concern you. And some people will say, well, these lines here. And that's more from muscle movement.
Okay.
So you would need a muscle relaxer or a neuromodulator. So that would be your Botox, your ZMN, and your Dysport. But then places where you're losing volume, let's use this example again.
Okay.
You can fill these lines, but really it's from bone regression and
that's frown lines. Is that what you call them?
Yeah. So these
like
nasolabial folds is the technical
Okay.
term.
Wow.
But frown lines, frown lines.
For
But
us non-technical people.
I know. So, but actually, it's from volume loss higher up. So we actually treat higher up to get rid of these lines. So if you think about it, as the bones regress or you lose muscle and fat, the skin has nothing to sit on.
Is this that whole gravity thing?
This is the whole gravity thing. This is
why everything just starts to sag and fall.
Unfortunately, it works against us sometimes, but we can reverse that.
Okay.
So we can lift it back up by adding some volumizers and fillers in little areas to help with that.
Awesome. And so I do think that a lot of people don't understand this concept either. You may see something in an ad, for example, where it says, okay, Botox or Juvederm or one of these options at X number of dollars per unit. And people think, oh, well, that's not too bad.
Right.
Explain to us really what a unit is and, roughly, I'm sure everybody's different, but that you need multiple units and how long they last and that kind of stuff.
Right. Okay. So a unit is, not to get too technical, but it's the biologic activity of the medication.
Okay.
So different units will correlate to different amounts of units based on the muscle that you're treating.
Okay.
So we'll use the smile lines again, or let's say here, the 11 lines as they're commonly called. Typically, a typical dose here is 25 units of Botox.
Okay.
But if we're talking Dysport, you need double the units.
Okay.
So when you're looking at, for our pricing anyway, when you're looking at Dysport, you want to double that price to make it apples to apples, so the unit-wise.
Got it.
Some people need a little more in the area. Some people, rarely, but some people could get away with a little less, but really it's a dose-dependent medication, meaning you want to fully treat the area to get the longest lasting results.
And about how long, speaking of long lasting results, roughly how long does it last?
So typically we say 3 months on average. Plus or minus, so it depends on your metabolism, your exercise, medications you're taking.
I didn't know any of that. Okay. And so does that kind of stuff, I'm assuming, helps the longevity of it or hinders it?
It's the only time.
Oh, so you're telling me not to exercise?
No. But yes.
Okay.
So exercising, increasing your metabolism, you can think of it as anything else. So
you're kind of burning it more.
You're burning it off.
Oh, see, this is really educational because I didn't know any of this stuff. So that's really good. And let's talk a little bit about, there's lots of people out there we know that are like afraid of needles or that kind of thing. Tell us what they can expect, what they can experience, how long does it take and that kind of stuff.
So I have a lot of first-time patients who are really worried about needles. Okay. But actually the needle that we use for the muscle relaxers, the neuromodulators, are as small as an insulin syringe.
Okay.
So teeny tiny. It's not even as bad as a bee sting, like just a little prick. Some people say they don't even feel it at all.
Okay.
So yeah, it's very small.
And is it something that you kind of do in more than one place, right? So you may do some units in one area and then move it over a little bit and then move it over a little bit. Yep, but absolutely. It's relatively minimally painful.
Very minimally painful.
Okay. And then how long does it take usually?
Oh my goodness. The consultation takes longer than the actual
deciding
procedure.
what you actually want to do, right?
What you want to do takes longer. But the actual procedure, depending on how many areas you're getting, could take anywhere from 1 minute.
Oh wow.
Yeah.
Okay.
To maybe 5, we'll say.
And you can come on your lunch break.
Oh yeah.
Nobody's gonna know when you walk out the door. Oh, she just had something, done.
So whenever you get it done, you'll see it'll look like little bitty bug bites because it goes into the muscle and it swells up just a little, and then your body flattens it out.
Okay.
And so after about 30 minutes, maybe an hour, it goes away.
Okay. And so you do the injections here. I want to talk a little bit about I don't know if certification or credentials or what that is, but we know that there's a range of different types of people that are providing these services, and just the importance of your training and making sure, because we all know accidents and mistakes can happen, and we want to make sure that anybody who's watching this, whether they're coming to Derm and Laser or anywhere, is going to someone that knows what they're doing. Yes.
Right.
So speak a little bit about that.
Yeah. So there are a wide range of providers and injectors who can inject. So there are nurse injectors, physician assistants, and physicians who can all inject fillers and neuromodulators. But you want to make sure you're going to someone who has been doing this a while and knows what they're talking about, and you want to do a consultation with them and make sure that they understand the areas that you're concerned with and can give you the best treatment specifically for you.
And this is your chance to brag on yourself as well. Please share with us what your credentials are and how long you've been doing it, because we would love to have people come in and see you.
So I've been doing it for multiple years, and I've taken many courses and worked with some of the best trainers across the country, which I think
continuing education is super important.
Yes. And I think I go to a different training probably 4 or 5 times a year.
Awesome.
And it's to pick up new techniques, because this field is so exciting. It's constantly changing.
Yes.
And learning new techniques and actually learning from other people's mistakes is a very, very important aspect to injecting. So I think just continuing your education with the injections is extremely important.
Awesome. Well, thank you so much for having us in here. If anybody has any questions, if they're interested in coming in and just having a consultation with Kalen or anybody on staff here at Derm and Laser, you can go to their website, you can call in, and someone will be happy to help you. And we just appreciate this opportunity. Also, if you'd like to learn a little bit more about Kalen and some of the other staff here at Dermatology and Laser, you can go to skirt.com and click on the Women at Work special section.
Thank you.